Hi, everybody, and welcome to Basic Black. You know, some of you are joining us on our broadcast, and others of you are joining us on our digital platforms. I'm Crystal Haynes, your host for tonight. Callie Crossley has the night off. Tonight, sickle cell disease. Sickle cell disease is an inherited blood disorder that affects red blood cells. The disease impacts the lives of nearly 100,000 people, predominantly of Black and brown descent in the United States. And that number increases to about 3.5 million people across the globe. Sickle cell disease affects every organ in the body, and treatment spans the lifetime of the patient. Right now, a bone marrow or stem cell transplant is really the only cure, and it is risky. Advocates say the limited treatment options, along with ongoing health disparities among Black and brown patients, make it challenging for them to receive the quality of care that they frankly deserve. Joining us this evening is Dr. Charles Azar. He is the medical director of the Comprehensive Sickle Cell Disease Treatment Center at Mass General Hospital. State Representative Bud Williams, representing the 11th Hamden District in Springfield, my hometown, and chairperson of the Joint Committee on Racial Equity, Civil Rights, and Inclusion. Carissa Juarez is the mother of a child living with sickle cell disease and the patient ambassador for the Massachusetts Sickle Cell Association. That's formerly the Greater Boston Sickle Cell Disease Association. And last but not least, of course, is Dima Hendricks, health advocate, activist, sickle cell warrior, and the founder of Through the Pain. Welcome to you all.
Thank you.
Yeah, this is going to be a dynamic discussion. You know, this is a disease that has been around since the 1900s, and some reports say even before that. So why hasn't sickle cell disease received more attention? And Dr. Azar, I'd like to start with you.
I think, thank you so much for having me. I think the answer to that is really simple. It's a disease of Black and brown people. I think sickle cell disease is the picture of health inequities in our healthcare system. For the last 200, 300 years, patients with sickle cell disease have been mistreated in this country. Even though we've only known about the disease for the last 120 years or so, patients long before that with severe pain were not being treated appropriately because of the color of their skin.
Carissa, why do you think that people like this isn't being spoken about?
I think there's not enough education out there, first of all. We need to advocate more. I agree with the doctor that, you know, this has a lot to do with the color of our skin and where we come from and stuff like that. I think this is a big issue. This is one of the biggest issues. And because of that, there's that lack of education and knowledge to it. There's a lot of, biases to this. And it's sad. It's really sad because it's things that we have to go through every day, you know, even within the family, you know, at hospitals, at schools, anywhere, you know, it's a tough thing.
Yeah, Representative Williams, you know, when you bring up this topic on the committee, in the House of Representatives, is this something that people know about, or is it at the top of their list when they're talking about health disparities?
Health disparities in this country and the Commonwealth of Massachusetts, as we know, are out of whack when it comes to Black and brown people. And what we have discovered and found out during COVID-19, the health system just doesn't work. When you magnify that and start talking about a disease like sickle cell, which years ago it was talked about, and as I was talking to the SDC warriors, it almost like it went radio silent in a sense. We triggered it back with the great doctor and we brought it back. But we know any disease that affects Black and brown people disproportionately is not on the front burner. And that's a challenge. And what happened during the George Floyd moment, when he took the knee, it magnified the inequalities in just about every single system in America.
That's right.
And especially the health system. One of Dr. King's last great words was talking about healthcare. And healthcare just hasn't worked. And certainly we have tried in the House of Representatives to refocus our energy with the great work of the advocates who have been on the ground a long time. putting funding. We allocated $250,000 for the Greater Boston Sickle Cell Association to do some outreach work and education. That was led by Rep. China Tyler. And then we also put in a couple other key legislative initiatives, which was to make the Mass Health Department start reporting. We actually don't know how many cases that we have in the Commonwealth. Now, when I first started, we were talking about 1,000 cases, Doctor, a couple of years ago, but now I think they've done more research. They say 1,600. I would think that would be less of a number. And the last piece that we tried to do was start the SDC Commission, led by State Rep. John Santiago, who's out of Boston, who's a doctor, and create this commission that really gives some teeth, some energy, and put this on the front burner. If this was happening to any other segment of our population, other than black and brown people, there would be more energy, more attentive. And I always bring up breast cancer. My wife is a two-time survivor of breast cancer. But when you say breast cancer in America, you get the chili, you raise money, we go. We're gonna walk on Sunday. We do the Raise of Hope walk. We'll walk on Sunday. You say sickle cell, it's blah.
Yeah, Dima, you have had sickle cell your whole life.
Yes.
What has been your experience with awareness of the disease and how many people suffer with it?
So awareness actually begins with the family. Culturally, my mom's Jamaican, my father's Nigerian. There's shame that's associated with the stigma of sickle cell disease, and there's a force to do better. We always, especially in my Nigerian culture, you gotta grow up and be a doctor and grow up and be an engineer. We have to save face. Oh, you're in pain? Drink some ginger ale.
Wow.
Rub some Bengay, walk out the door, you're fine. Here's some herbal methods. And so that's why we're so quiet. Warriors can tend to be quiet about the disease, especially in India. There's a lot of people that have sickle cell disease, but they're so quiet about it because of the stigma that's related to the disease.
Dr. Azar, talk to me about when we're talking about treatment options, and we were talking a little bit, off camera about how there are certain treatment plans, access to treatment is a problem. Talk to me a little bit about what that looks like.
Yeah, I mean, the reality is that there are not enough treatments. In the last 20 years, we've had only 3 new drugs come out for this disease. If you compare it to other chronic congenital diseases like cystic fibrosis, which is a terrible disease, but 14 or 15 new drugs have been developed over the course of the same time period. And we unfortunately have not had anything akin to that in sickle cell disease. The therapies that we've got now are limited in what they're able to accomplish for patients. The one drug that has actually been shown to help patients with sickle cell disease live longer, and there is only one drug that has been shown to do that, has been around for over 20 years, has not changed, has not been modified in any way, and is an antiquated chemotherapy drug that we've had to sort of wedge into sickle cell disease.
Carissa, you were talking about, just getting your daughter on the right cocktail of medicine so that she can live as an 11-year-old, even though she's still in some pain every day.
Yes, she is on a lot of medication every day. She can take from 7 to 15 pills a day. And it's tough, and half of these pills are just pain controlling pills, and then there's the chemo portion of it too, it does help, but there's side effects to all of these things too. So, for example, the chemo pill that he was talking about, my daughter has started to lose some hair, has a little bit of bald spots, and then there's the narcotics, which is the pain controlling, and it's tough too. For an 11-year-old, it's kind of hard because she can become tired from it, or she's not quite focused. She has to go to school. She can't really focus. She's sleepy. There's a lot of things that come in place with this. And then, she's frequently on a lot of Motrin, so we have to watch her kidneys and stuff. Tylenol she was given at one point doesn't really do much for her at all. So I eliminate it because, why trigger the liver, when we're already triggering other parts of the body that you know, with all the other medications, it's tough. It's really hard. And then, you know, from having sickle cell, there's other complications that come into effect also, you know, and it's really hard on her. You know, right now we're facing an issue with possible diabetes with her because, you know, that also runs in our family, and I'm Hispanic, and her dad's Dominican, and I'm Guatemalan. So in my family we have diabetes really bad, and so does her father's side. So now it's like there's another complication in effect with the sickle cell, and you know, is it going to become even worse, her sickle cell? There's so many things to it. And she's a woman, and now she's going through puberty, and then hits, you know, when the menstrual cycle comes around, there's a whole different thing to that too.
Oh, yeah.
So it's a lot. And right now she's right there at that stage where we're starting to learn what's the next things that are going to happen. And it's really tough on her. It's tough. And going to school is hard, and, you know, it's a challenging thing.
Yeah, I bet.
It's hard.
I bet. Yeah. And Dima, you were saying, you know, amen over here to everything that Carissa's talking about going through with her daughter. I mean, I imagine you have all of these treatment options you probably have had to go through since you were diagnosed when you were small, and then COVID.
Oh, yeah.
Right.
Yes.
So I think COVID was actually a saving grace for me because it taught everyone else to wash their hands, to cover their face. I didn't get sick as much because everyone was being, you know, cautious and extra cautious. Because when I catch anything, a cold or whatever, I used to be in the hospital like that. But as Carissa was saying, she was talking about her 11-year-old. When I was 11, I had my first stroke. I had, my gallbladder was removed around 10. I had blind in one eye. My spleen's not working. I've had open heart surgery. I've had multiple surgeries, but I look fine. So it's kind of hard to navigate the disease while I look fine, and trying to tell people that no, I'm in a lot of pain. I tell people, you know, I have 2 children. I had a cesarean birth and I had a natural childbirth with my first son. And when I was having contractions, and I couldn't feel them. And I was absolutely fine. My son's father was looking at the machine, and my contractions are going up, and he's going crazy. And I'm like, dude, what's wrong with you?
Because your pain tolerance
My
was so
pain
high.
tolerance is ridiculously high. And I didn't feel the pain. I just kind of, when my water broke was when I realized, oh, okay, I'm having a baby. But I would rather have 10 children naturally before going through a major sickle cell crisis. It's that painful.
And Dr. Azar, I mean, when we're talking about COVID, we're also talking about we had critical shortages of blood, and blood transfusion is part of the treatment plan here. And then you couldn't really see as many patients through the ER. So if someone was in crisis, you know, talk to me about having to navigate that.
It was an enormous struggle. Yes, the blood shortage itself put us in a very difficult situation. But even when we aren't in a national blood shortage like we have been over these last few years, there are not nearly enough donors of color to be able to accommodate our patients as well. But when patients are going through what Dina or Carissa's daughters are going through, these are not things that can be done through Zoom. These are not things that can be done remotely. So our patients are having to come in, and we had to be boots on the ground through the entire pandemic to be able to make sure our patients got what they needed.
And Representative Williams, when you were trying to access or allocate, you know, resources, especially during the pandemic, does sickle cell even end up on the list? Or sickle cell warriors end up on the list?
Yeah, it did.
Oh, it did?
It absolutely did. This is the first year of funding, I think, in the history of the Commonwealth
That's
that we
amazing.
actually funded for sickle cell due to the great work of the Warriors.
Yeah.
Dr. Veritex, which is a new organization, no, not a new organization, but they're creating a new gene therapy to, you know, treat sickle cell. But I just want to, this is what it's going to take. You, Basic Black, programming, talking about it. This is the only disease that I know of that affects every single organ of your body.
Yeah.
Think about it.
Yeah.
I mean, you might have a heart condition or a lung condition, and you kind of deal and navigate it. When you have a disease that from head to toe affects every single organ, and as they were saying, and that's where the racial inequalities come in, because the shame and the guilt. And they've been making black and brown people feel guilty and ashamed in this country for a mighty long time. So you marriage that, combine that, and you get this mosaic of this individual that has the SDC, sickle cell. So we were able to, due to the advocacy and the great doctor, and we're going to do even better. We're going to try to do better.
Yeah.
It's on the front burner, and we're going to put it on the front burner because of the great work of the warriors, and I want to commend you folks. Really, you have a lot of courage, and you energize me, and I've learned so much in the last 2 or 3 years working with the doctor and Mass General and Veritex and trying to get that new gene therapy. And what I said was that, and doctor was saying this too, because that's how I really got involved with it. Dirk and Veritex, they're on Beacon Hill, former House Speaker of the House, Chairman Finnerman is on there, and Dr. Sanchez, Ways and Means. And I said, even if we do get a new gene therapy, it will be, you have to approach the same way the COVID-19, Omicron and Delta were approached. The trials have to be the right people to be part of the trials.
And the money.
And the money. Well, that disease, as you know, Crystal, lifetime treatment. Take a guess.
Yeah. $1 million.
3 times that.
Wow.
$3 million. Lifetime treatment. It's very, very expensive, and that's part of the problems we see it. You know, hospitals are in it for health care, but some of them look at their bottom line, which is the profit making. And treating this disease is not profit making.
So, Dr. Azar, talk to me about this treatment program with Vertex and CRISPR, because I understand it's a gene therapy that's trying to be developed. We spoke earlier about, I mean, the treatment options are archaic, to say the least, right?
Yes. We're excited that there are companies like Vertex and Bluebird in the community that are working actively to try to find new therapies now, because the attention has, I think, finally begun to swing in favor of helping us to develop new things for sickle cell disease. Gene therapy is really exciting, and we're really looking forward to seeing how it rolls out, but it's also not easy to deliver. It's still a stem cell transplant-based therapy, and so there's still a lot of steps and a lot of complications that can go along with that. And at the same time, when it becomes available, it may be available in this country, but let's not forget that the vast majority of people who are living with this disease are not in this country. And we have a difficult enough time getting basic medications like hydroxyurea out to other countries where the disease is endemic. And we certainly are not going to be able to bring out gene therapy in mass. And it won't even be accessible to everybody living in this country as well.
Right.
Those are all things that we have to think about.
And there are multiple types of sickle cell, and I don't think people realize that as well.
That's right. That's right. There are multiple subtypes of sickle cell disease. When we use the term sickle cell disease, it's really an umbrella term. We're talking about somebody who has one copy of hemoglobin S as well as something else. And that something else could be another copy of hemoglobin S, and that we call sickle cell anemia. But then when it's partnered with something like beta thalassemia or hemoglobin C, those are all different subtypes of the disease. Unfortunately, even though the textbooks will tell you that one of these subtypes behaves a certain way and not the other, in real practice, when we're seeing our patients, regardless of their subtype, they seem to have the same complications. We don't have the knowledge to be able to, what we say, genotype, phenotype match these patients. In other diseases like, say, hemophilia, a national federal effort has been put in place to try to genotype, phenotype match these patients. If you have this mutation, this is how we can predict your disease will behave. We know nothing like that in sickle cell disease.
Yeah, and access to treatment ends up being a problem. I know Dima and Carissa, you all were talking about when you go to the ER, there are serious barriers to entry. And Carissa, you were telling me recently, you were like, I know what my daughter needs. She's in an emergent situation, and you're seeing those barriers in the healthcare system.
Yeah, so I don't have the sickle cell. My daughter has it.
Right.
I'm sure Demon understands where I'm coming from with this. We want to avoid going to the hospital. We don't want to go to the hospital. We're tired of the hospital. We're tired of the clinic. So we try our best at home to manage everything at home. The problem is sometimes it doesn't work at home, and we need IV medication for the pain. Oxygen is required. Several things. So, yes, we go to the emergency room, and it's like, yeah, okay, we're here. My daughter needs some IV pain medications, and we don't get that right away. She's in excruciating pain, and we're waiting over a half an hour, okay? Sometimes, you're supposed to call the hematologist on call, and they're supposed to put like an expecting in to say, okay, this family's coming in, maybe this is what needs to be done, and so on. And then, we're supposed to be brought right in, okay? Because we're at risk. We can't sit out, especially with the COVID, okay? With COVID too. You can't sit out in the waiting room, okay? And mind you, this means if you're sickling, your red blood cells are not traveling through your body as it's supposed to be. You're lacking oxygen to your major organs, okay? So it's not just pain, it's the lack of oxygen, okay? So what happens is we're there and we're still being put to wait to be seen. And we shouldn't be, because the doctor already called, the hematologist already called and said, hey, when this family gets there, they need to be put into a room right away, and this is what needs to get done. And it doesn't happen that way.
Yeah.
Sometimes we come in and it's like, all right, well, let me give you some Motrin right now. No, excuse me, doctor, no. I did that already at home. I didn't come here for Motrin. We came here because we need IV medication, okay? And I need it ASAP.
And Dima,
She's in excruciating pain.
Exactly. How do you manage that?
I can't really express the PTSD and the trauma that happens in the emergency room. The last time I was at the emergency room, I walked in. I was able to articulate my pain. I was able to articulate the number. Said that these things weren't working at home, but I can feel my body starting to get into a major crisis, and it was getting worse. 2 hours later, my husband had to help carry me into the triage area. So, not being believed, not being heard, not being validated, the very essence of what makes me feel like a human being or a woman is just stripped away from me every time I go to the emergency room. So I avoid going there at all costs. And that's something, in addition to the research, we also need to talk about the mental health aspect of sickle cell disease.
Absolutely, especially if you're mentioning PTSD. Doctor, how do we do better? How do we do better in the system?
So this really requires a top-down change. There are federal resources in place for other chronic congenital diseases. It is shameful that we don't have the same kind of resources for sickle cell disease. So there is a significant political component of this as well. But our healthcare system also needs to learn to do better. And it begins by recognizing the endemic racism within our healthcare system. Once we can confront that, we can start to learn to take care of our sickle cell warriors better when they're coming in. The one thing we also never talk about is how this disease affects people on their day-to-day lives. People lose their jobs. People can't go to school. And as a result of that, their lives are completely changed. We as a center have to try to provide resources for our patients just to be able to get to clinic every day. These are resources that our society should be able to provide for our patients. Should not be falling on individual hospital teams to be able to even do something as simple as an Uber ride into clinic.
Representative Williams, how do we legislate to do better, right?
We're attempting to do that now by working with House and Senate leadership, and U.S. Senator Cory Booker has filed some interesting legislation federally to, as the doctor was saying, hopefully get some funding. And we have to just make it a top priority. It has to become a priority. It has not become a top priority, and I would suggest to you, Crystal, it's because it affects black and brown people primarily, and that's a problem. So we'll continue to fight on Beacon Hill. We're looking for more funding this year and working with our federal government. Hopefully legislation that Cory Booker has filed will pass the House and Senate and create what the doctor's saying. It's the everyday piece that I think the mass sickle cell association wanted to get that across. That's what doctors, it's every day they go through this. They can't go to school, you can't work, you can't shop, you can't watch your kids, you can't baby. You're paralyzed in a sense. So certainly we want to do the global thing, which is the gene treatment and more treatment, but we have to have that everyday kind of services.
Well, I want to thank you all so much for having this conversation with us. And unfortunately, that's the end of our broadcast and the end of our show. Thank you so much for joining us today. Now stay with us as we continue this conversation on our digital platforms, Facebook and YouTube. Have a great night.
Thank you so much for doing this.
Hi, everybody. I'm Crystal Haynes, your host. You know, we are on Facebook and YouTube with our post show continuing our discussion on sickle cell disease. And I want to go ahead and pick up where we left off, where we were talking about really what it is like to live with the disease and the excruciating pain that those who suffer live through, right? And so, Dima, talk to me a little bit more about what your day-to-day is like. Right?
It's interesting.
Right.
It all depends on the weather. It depends on if I'm having that time of the month. It depends on if I'm happy, sad, or angry. It's whatever my body feels like doing for that day. On a good day, I maybe have like a 5. I wake up with a 5 out of 10 pain, you know, and still able to
But it's never a
navigate.
0.
It's never a 0.
Wow.
On the days where I have a 10 out of 10 pain, my husband usually stays home with me, and we try to navigate the pain together, and he helps me. But it's excruciating. I mentioned childbirth earlier in the show, in the broadcast. There's a gentleman who has sickle cell disease. He told me that he was shot, and got shot in the leg and shot in the head. And he said the pain of sickle cell hurts more than being shot. So just imagine the breadth of like the pain that we are going through is actually extremely excruciating.
Yeah.
Yeah, it's a lot.
And Carissa, as a caregiver of a child with sickle cell, you know, I can imagine as a mother, there's a different kind of pain there for you because you're trying to do everything you can to, you know, make your daughter whole as much as she can be.
Yeah, it's tough. I always say I wish I can be the one, you know, with the pain. Can't take it away from her, you know, and it hurts me to see her going through that pain. I try to hold my tears back all the time and be strong. Because when I do cry, she's like, Mommy, you told me we have to be strong, so stop crying and let's be strong. We can do this, you know? And it's great because she's like my motivation every day, you know? But it is hard. It's hard. I worked for the Commonwealth of Massachusetts. I was a state worker at the Department of Transitional Assistance. I had to give up my position to take care of my daughter. I couldn't. I exhausted my FMLA. I care about my clients, and I couldn't be there for my clients. And I was like, I can't do this, you know. I have to be there with my daughter. So, you know, financially things change. It's hard. It's a hardship, you know. I miss my job. I miss there's so many things, and I have 5 children, and that's another piece. I wasn't able to dedicate enough time to all my kids because I'm always with her in the hospital, you know. So it takes a toll on a lot of things, even relationships. It will take a toll on your relationship because you're not having that bonding time because you're in the hospital with your child, or you're taking care of her, or going to clinic appointments, and it's been really tough. And then her siblings, they suffer. They go to school feeling sad, you know, and upset because they're seeing what their sister is going through, you know, and it's hard. And I think there also needs to be fundings put in place for supports for the family because they need therapy. They need to be able to do things with, you know, their siblings or mom and dad because it's tough. It's tough. It takes away from everyday life.
Sickle cell's a dream shatterer. I grew up wanting to be a dancer. And, you know, I danced for as long as I could. And after my stroke, it wasn't the same. I couldn't rhythmically do the things that I used to do. And so I had to find another second resort. And then Plan B became Plan C, and Plan C became, I'm all the way down to Plan Z at this point. So it not only takes away from the warriors, we are resilient. That's why we have our name.
Well, you have to be.
Yeah, we are resilient. However, it's hard to see the people that we love around us. Their dreams are stolen and taken away because of our illness, and we feel so responsible. My husband had to sacrifice things, and I see you as a mother sacrificing things, and my mom had to make so many sacrifices, all because of this disease. And it's devastating at times.
Yeah.
You know, I always say I can't put hydroxyurea in the mouth of a patient if I can't put food in their mouth first. Because so many patients have lost their work or can't go to school. They can't put food on the table. I've got many patients right now who are having to pick and choose which medications they pick up from the pharmacy, or trying to stretch their prescriptions to go out longer in order to be able to get through the month. And they have to choose between how they can take care of their kids or get their kids to school. Single mothers who have no one to be able to support them at home. We're having to provide our patients with cell phones because they don't have mobile access.
Wow.
Yeah.
Do you think often, and we were talking about this as well, as like people who have high pain tolerances with sickle cell disease, they don't present as someone who quote unquote looks sick. And so they walk into spaces asking for help, they walk into the ER asking for help, and they aren't believed.
That's exactly right. A young black man walking into the emergency room who can tell you exactly what dose of Dilaudid he should be on and is staring at his cell phone the entire time because that's the only thing that keeps him from being in pain, that is a red flag for that emergency department.
And they'll literally red flag you in the
Exactly
chart.
right.
Yeah, it's really a thing.
But I think that, you know, there are protocols in place in these hospital situations. It's people just don't use them.
Right.
They're trained, they're talked about. But as a black man, if I walk into the emergency room, they look and they stare. It's just a game changer. They just look and stare. What are you here for? You looking for some drugs or whatever? And that's bad. But the other piece, I think, the awareness piece, Doctor, is very huge. So we have established through the Department of Public Health for them to conduct public hearings in the Commonwealth of Massachusetts to talk to people, to get the data, talk to people, and bring it back so we can do something with it. So people can make the case that we have to do better as a Commonwealth. You know, Massachusetts, we always say, is ranked in education, and first school, first of a lot of things.
Yeah.
But in some categories, we're last in a lot of cases. And this healthcare, dealing with this disease, I'm not happy to say it, we're at the low end of the totem pole And we're going to do better. We have to do better because the citizens deserve it. They really do deserve it. And just hearing these public testimonies and the doctors on the front line every single day.
Right.
Just imagine every ounce of your body from head to toe is
in pain.
affected by this disease. And you're in pain. See, which people don't understand, I didn't really understand until I was educated, that these folks are in pain every single day.
Yeah.
It's not like, taking Excedrin and you take some Motrin and the headache goes away and then it comes back the next day. It's literally 24/7.
Well, you mentioned your pain is never a zero.
It's never a zero.
Yeah, and so when we talked a little bit about the funding for cancer, especially breast cancer, did things like the sickle cell walk help in terms of funding for new treatments, research, family supports? Did it help?
I think it helps, but I think it does another thing. I think it brings the awareness. Awareness is very key with this disease. As I said, since the 1900s, it's been around. Never has been on the forefront in America in terms of all the other, heart disease, lung cancer, breast cancer, prostate. Never in that, you don't really hear sickle cell in that category. No. When you talk about, when they define the health system, sickle cell very rarely is mentioned, so it's up to us as individuals and sickle cell SDC warriors, I call ourselves, to bring the awareness in your face. We're going to do better. We have to do better.
Yeah. Doctor, do you see the immediate effect of something like the sickle cell walk?
Oh, I do, only because I think it's wonderful to see patients who have never met anybody else with sickle cell disease come together to see other people. And I think it's also wonderful I watched my own patients who are at the walk see that there's a community that is behind them.
Yep.
I think one of the powers of an organization like the Massachusetts Sickle Cell Association is that beyond the siloed worlds of the hospitals, a community organization like Massachusetts Sickle Cell Association is there to be able to try to put boots on the ground to help patients where the disease hurts them the most.
Right.
Yeah.
It's not in the four walls of our clinics. It's in their everyday lives.
Yeah. How much is building community important to patients and family?
It's so important. I have the opportunity to be a sickle cell health coach, and the program that I'm under, we're coaching about 300 participants that have sickle cell disease.
That's great.
And right now I have 20 participants, and I'm able to talk to them about the effects of sickle cell, and they're talking back to me, and we're communicating, and to hear them, and sometimes we do video calls, and to hear them or to see them light up and say, wait a minute, there's someone like me. And they'll ask questions like, wait, does your foot do this? And does your arches do this? Does your head do this? And wait, let's compare. Does this happen during this time of the month? Does your elbow do this weird thing? Like, we'll compare notes, and we kind of build a friendship and a sense of community. So it's very important to have that camaraderie and that sense of family.
Yeah,
absolutely. I think the other point, don't forget this, the life expectancy of STC patients was about 45 years of age. That was the average. That average now has gone, I know, doctor, 55, maybe 60 years of age. So it's indicative upon us to start really getting, because people living a lot longer is the point. So we need to make their life a lot better and get some kind of health care, medication, or gene therapy to help them live longer. And let's just think, let's roll it out again. It could end up being like 75 years of age.
Yeah.
So now it's really, and it's in the future is right now. It's like a 911.
Yeah. And Carissa, I really want you to talk to us again about this life expectancy piece, because a lot of, like you were mentioning, when you get a cancer diagnosis, there's an estimated life expectancy.
Absolutely. So my mother was a survivor of cancer who recently passed about a year ago due to other complications, but it had to do with the cancer too. So yeah, you have when you're diagnosed with cancer, they may say, oh, you have 6 months, a year, 2 years, whatever the case is. With sickle cell, though, we have this life expectancy. That's not to say that something, like as I was saying, my daughter may be good today and tomorrow be on her deathbed, because there's so many complications that come into effect with sickle cell. You know, there's acute chest. She recently was hospitalized, and then she was placed on several narcotics for, you know, pain medications for her pain, and her respiratory rate went down to 0. And we were like, in a rush, like, are we gonna have to intubate her? Is she gonna have to be on breathing tubes? You know, her oxygen was dipping. We had to keep having respiratory come in. You know, you know, a stroke. We're at high risk for a stroke, you know? So it's like, you know, I can be walking around with a smile on my face today, and tomorrow I might not be here. So I think that that's really important. I think this needs to be known, you know? We need more fundings. We need more education. We need more programs in place. You know, thank goodness the hospital that my daughter's in right now, they're trying their best to do what they can there. She's part of Hasbro Children's Hospital in Providence, Rhode Island, and they Lifespan is there, and they have like the psychologist team is doing a meeting every third Wednesday, and we gather up, as she was saying, like the community and stuff. We get to meet other people who have sickle cell, whether it's great because it's a new, I'm just introduced to this program, and I'm seeing they have children my daughter's age, they have the teenagers, they have the adults, and I'm telling my daughter, we are going to this because we get to see from a child's perspective, from a teenage, and even meet adults. They have the same thing that you have, and see, maybe, hey, maybe you go through the same thing I go through. And she put this great smile on her face and said, let's do it, Mom. Let's do it. I want to meet other people and see if they go through what I go through. So yes, I think, as you were saying, like, does the sickle cell walk do something? Everything does something, but we need more. We need more.
And it really begins at home.
Yeah.
Because imagine if your daughter didn't have you.
Yeah.
Imagine if I didn't have my husband, if I didn't have, you know, my children. There's a lot of people with sickle cell disease that go through it alone, and they're swept under the rug because they don't have anybody to speak for them. And we're privileged to have people like yourself to speak for us on our behalf when we can't speak.
Yeah.
And I thank you for being here.
Right.
And
Well, I want to thank all of you. I want to thank everybody for being here. I really appreciate your time, Dima Hendricks, Carissa Juarez, Dr. Charles Azar, and Representative Bud Williams. Thank you so much for tuning in for this important conversation. And of course, more information on WGBH.org. We'll see you next time.